Hi, my name is Lucas Poo, and today I'll be talking about my project on body tissues affect lung nodule malignancy and growth. Early diagnosis and treatment of lung cancer is crucial in order to lower mortality, and to diagnose lung cancer, one first has to go through a lung screening test. Low-dose computed tomography, or LDCT scan, is the golden standard for lung cancer screening, but has a very high false positive rate of over 95%. Of those screened, 24% were indeterminate pulmonary nodules, or IPNs, that required follow-up diagnosis, with a total of less than 4% having or would develop cancer. This means that most detected nodules are benign but require unnecessary and potentially harmful follow-up procedures such as biopsy or even surgery due to the lack of accuracy in determining nodule malignancy. As a result, it is crucial to be able to accurately and non-invasively assess these IPNs. However, the problem is that current non-invasive methods cannot guarantee high accuracy in determining malignancy. Thus, it is necessary to find a new biomarker that can help us assess these IPNs. In this study, we wondered and aimed to investigate whether body composition, which is the amount of fat and non-fat tissues that our body is composed of and reflects one's habit and lifestyle, may affect lung nodule malignancy and growth. Here's our study design. First, based on a set of selection criteria, we created a cohort of 159 subjects with and without lung cancer. Then, we segmented the nodules and body tissues on the subject's baseline and follow-up CT scans. After segmentation, we computed the values of various body tissue and nodule features, such as their volume, density, and mass. We then conducted bivariate correlation analyses between these body tissues and nodule variables and with the nodule growth metrics and malignancy. Using the malignancy-associated variables, we developed logistic regression models to predict malignancy. To investigate whether body composition is correlated with nodule growth, we compared it with various growth metrics, including doubling time and relative nodule growth, such as their relative volume change and surface area change. Notably, associations between body tissues and nodule growth were found only in malignant nodules. To summarize, the subcutaneous adipose tissue density, or SAT density, and skeletal muscle, or SM density, on baseline scans, along with SM density and bone density changes between the baseline and follow-up scans, were negatively correlated with various malignant nodule growth metrics, while the intermuscular adipose tissue, or IMAT volume and density, on baseline scans had positive associations. We also compared nodule and body tissue characteristics with malignancy. Essentially, many baseline and follow-up nodule and body tissue characteristics, such as the nodule mean density and IMAT density, were significantly associated with malignancy. Surprisingly, there was no significant association between malignancy and doubling time. Initially, when given only the baseline CT scans with the presence of small nodules, both body tissues and nodule variables contributed significantly to malignancy prediction. Model 1, which only incorporated baseline nodule variables, achieved an AUC of 0.84, while Model 2, incorporating only body tissue variables, achieved an AUC of 0.781. When we combine both body tissue and nodule variables to build Model 3, the AUC increased to 0.882, showing that body tissue characteristics significantly enhances the predictive power. The significantly larger AUC values observed in Models 4, 6, 7, and 9 are primarily due to the inclusion of follow-up nodule variables in these models, where the nodules are larger and malignancy characteristics are more obvious. To conclude, body tissues are significantly correlated with malignant nodule growth, but not with benign nodules. Notably, in this study, the nodule's volume doubling time was not a good prognosis factor in assessing malignancy. In the lung cancer screening setting, when nodules are small in baseline scans, body tissue characteristics, specifically the densities of IMAT and SM, significantly contribute to malignancy prediction. To further confirm the impact of body tissues on malignancy, it would be very beneficial to collect more data, increase data diversity, and validate the performance of the models on an independent dataset. Thank you.